And now, I'd like to welcome our speaker today. Dr. Saraswati Sukumar is the Barbara B. Rubenstein Professor of Oncology at the Sidney Kimmel Comprehensive Cancer Center at the Johns Hopkins University and a professor of pathology at the Johns Hopkins University School of Medicine. She began her faculty career at the Salk Institute in La Jolla, California, and moved to Johns Hopkins in 1994 to lead the basic research program in breast cancer. Her lab has developed groundbreaking diagnostic tools for an early cancer detection and therapy monitoring, including rapid tests for use in low and middle income countries. She is very passionate about cancer prevention through lifestyle, particularly natural products, meditation, and a vegetarian diet. As someone who has worked in biomedical research and now pursuing a career in intellectual property law, I am very excited and inspired by Dr. Sukumar's ability to bridge science, innovation, and health. Now, her talk today, Common Cancers That Afflict Us, Empowering You with Tools for Prevention, will cover symptoms and staging of prevalent cancers like breast, colon, and prostate, explore both traditional and emerging treatments, and most importantly, share actionable tools for prevention and healthy living. Please join me in warmly welcoming Dr. Saraswati Sukumar.
It's indeed a great pleasure to be among you, to share some knowledge. You and I will learn a lot during this talk. So, common cancers that afflict us and empowering you with the tools for prevention. So, we will define today the properties of cancer cells. And together, we will set out to ask, is it possible to put a halt to pre-cancerous cells? What is a cancer cell? What are its unique properties? And disease-defying role of diet, exercise, and meditation, and how? Our focus today is on cancer. Cancer is a disease caused when cells divide uncontrollably and spread into surrounding tissues. And cancer is caused by changes in your DNA. Most cancer-causing DNA changes occur by turning on genes that are responsible for growth and shutting down genes that put the brakes on cell division. Cancer is really a disease of old age, and by 2030, it is expected that approximately 20% of our population will be 65 years or older. So when we say cancer is a disease of old age, what do we mean? These charts show you the incidence per 100,000 cancers on the y-axis, and they show at the bottom the years, all the way from 2000 to 2019. And what we see is when we look at all the cancers, on the left, you see that there is a big, broad orange band, and that is 0 to 39. Remember, children develop leukemia and so on. And so that basically large band represents a lot of childhood cancer. The pink band is 60 plus cancer. And as you can see, that is a very broad band. And at the bottom are all the in-between ages. So this particular slide shows you all cancers, lung cancer, breast cancer at the bottom, and colon and rectal cancer at the bottom. So let us find out, what is a cancer cell? A cancer cell acquires many genetic changes that allow it to survive and divide uncontrollably. It's like a train at full speed without any brakes. It is like a runaway train that ignores all the stop signals that are normally there. so that it doesn't become a cancer cell, and it ignores it and goes through all the stop-go signals that normal cells respond to, and keeps dividing and bolts through the barriers and walls that are erected to stop it. So on this slide, you see, sustains its ability to multiply endlessly. It evades the breaks present in the cell. It evolves so that it can spread throughout the body. It enables immortality. There's no dying cancer cell. It just keeps dividing. It encourages blood vessels growth to bring nutrients to it, and it resists all cell death signals. So the major cancers that afflict us are prostate cancer, breast in women, colorectal cancer affecting both sexes, and lung cancer afflicting mostly men. But today, in the interest of time, I'll speak to you about prostate cancer and breast cancer. So these major cancers, what is a normal tissue? What are the first signs that this normal tissue shows to say that it is becoming cancerous? What is the origin of the cancer cell in that organ, and where is the cancer located? How does it grow there? And what are the first signs that you can detect and alert your doctor to have a deeper look at what is going on in your body? So just suppose you have some suspicious signs, and I will talk to you about the suspicious signs. What happens next? Next is diagnosis, treatment, and lastly, very important, steps that you can take to prevent the cancer from spreading. So we'll talk now about prostate cancer, and prostate cancer is common and a cancer among men. And here are some of the prostate cancer facts. It's the second leading cause of cancer death for men. 1 in 44 men that you see all around you will die of prostate cancer. And right now, over 3.3 million women live with a cancer diagnosis. And finally, 100% of prostate cancer is curable if it is caught early. What does it look like? I told you I will share with you what a normal prostate looks like and where does that cancer arise. So the prostate is a reproductive organ, and it is located below the bladder in front of the rectum. And that is what you see over here. That one. And then it is below the bladder and in front of the rectum, and it's the size of a walnut, and it produces the semen fluid in which the sperm float. So it has a very critical function in the reproductive system. And how does it become a cancer, and how does it progress? So here you say, as men age, the prostate may get bigger. This is a natural phenomenon. A bigger prostate may block the flow of urine from the bladder and cause problems with sexual function. This condition is called benign hyperplasia. And then what happens is that gradually this benign hyperplasia is not cancer, but surgery may be required to correct it. The symptoms of BPH or other problems in the prostate may then lead to what I show you here, the beginnings of prostate cancer. And then this becomes a prostatic cancer that begins to spread throughout the organ. And not only that, it begins to spread into the lymph nodes and then into circulation. So what are the prostate cancer warning signals? And I see that many people don't know this. They don't know about breast cancer or prostate cancer. And sadly enough, in our Sangat, I found out they don't know about ovarian cancer either. What are the prostate cancer warning signals? Frequent urination, especially at night. An urgency to urinate. I got to go now. Difficulty starting to pee. Straining or prolonged peeing, a weak urine flow, stop and go, feeling of incomplete bladder emptying and blood in the urine or the semen. And how is prostate cancer detected? A very common test is the prostatic specific antigen, or the PSA. when you have just 4 nanograms per milliliter of blood, as shown in the bottom panel, you have a 15% chance of having prostatic cancer. But if it goes up to 10 nanograms per milliliter, there's 25% chances, and above 10, there's over 50% chance of having prostate cancer. But the PSA test is not very accurate. It is very sensitive, as we say, but it is not very specific. So what are the false alarms that you can get? Old age generally is accompanied by higher PSA levels. The enlarged prostate, as I told you, is not cancer, but it still produces more PSA. There is prostatic inflammation, you have high PSA. Urinary tract infections, you have high PSA. Well, those are not cancer symptoms, but yet PSA goes up. So people have imaging technologies to find out if there is a cancer in your prostate. And these are prostate MRI or prostate ultrasound or CT or computerized tomography scan for prostate cancer diagnosis. So CT scan for prostate cancer diagnosis, a computerized tomography scan or the CT scan is a type of imaging that uses X-ray techniques to give detailed images of the body. And the CT scanner rotates around, the X-ray beam rotates around your body, and the tests tell you whether there are abnormal growths in different parts of your body. So the biopsy of that tissue, the doctor says, hey, I see something suspicious in these scans. Let me put you through a biopsy. And a biopsy is where they take a pinch of that particular area where they suspect that there is cancer, and they fix it and they send it to the pathologist to look at. So the pathologist says, you have Gleason grade 1, 2, or 3, depending on how much of those cells look like cancer cells and how ugly do they look. When you have grades 1, 2, or 3, they say, just let's look at you. Year after year, let's see if that lesion is increasing in size or doing something. But lately, this is called active surveillance. And it's a very good technique because we saw that there was a lot of unnecessary surgeries and biopsies and everything going on in the prostate cancer field. So this has now become restricted and more careful handling of all the discomforts that happen when you take a biopsy and so on. But when you get to grade 4 or 5, you definitely need medical attention. What do they do? Like I said, treatment for grades 1 to 3 is watchful waiting. Monitor, delay treatment. These are slow-growing cancers, and there is low risk of spread. So it is possible that you may die with that cancer. Not to worry at all. You may be old enough to die, not because of prostate cancer, but because of other reasons. So that is watchful waiting. And when it comes to grades 4 and above, now you need to take action. So surgery is the first, it's a mainstay, removal of the prostate gland and sometimes the surrounding lymph nodes. Radiation therapy, where it burns the tissue so that the prostate cancer is removed. And by hormone therapy. These prostate cancer cells are very, very dependent mostly on androgen, the male hormone. Now, if you cut off the source of that, then the prostate cancer shrinks. So we have drugs that compete against the androgens, push it off, and then this drug goes and binds to the androgen receptor. Now the cell is unable to live and dies. And chemotherapy is the last one. In advanced stages, hormone therapy just doesn't work. We also add chemicals in order to kill those tumors. Why is grade important? Cancer is only in the prostate, then the chance of surviving at least 5 years is 100%. But if it has spread beyond the prostate, then your chances fall by 60%, and there's only 37% chance of you surviving for more than 5 years. So this is very, very important determinant of what your cancer is and how it should be treated. So Prevention with anti-hormonal agents. Finasteride and dutasteride drugs lower testosterone. The pros are, if you get treated by it, then there are fewer prostate cancer. This is one prevention technique that is used in the clinic. But the major side effects are that there is erectile dysfunction, there's loss of desire for sex, and there's enlarged breasts. So some men decide, hey, I need a quality of life, and this is what I want, so I don't want these drugs to be completely blocking anything that is fun. So I believe a safer alternative is your diet. You reduce your fat intake, eat less trans fats and saturated fats, focus on the healthy fats such as omega-3 fatty acids from nuts and seeds, eat more fruits and vegetables. No-brainer. Incorporate a wide variety of produce. The antioxidant lycopene, which is plentiful in tomatoes, is great as an anti-prostate cancer medication. And cruciferous vegetables contain sulforaphane, again, an anti-inflammatory agent, a great prevention. And add green tea and soy to your diet. Now we move to another cancer, that is breast cancer. Breast cancer, 1 in 8 women among us at some point in our life will develop breast cancer. So this is a very, very large statistics. Is breast cancer common? Very common, 316,000 cases, new cases every single year. And 59,000 women die, 59,000 new cases of ductal carcinoma in situ, which is a pre-neoplastic condition. And there are 42,000 deaths annually. Really, this is a very big killer. I wanted to quickly show you, and I don't know how much you can see of it, but where does this cancer arise? It arises in your milk ducts. So there are 15 to 20 of these ducts that all end at the nipple. And their normal function is to produce milk for the baby. But one of these cells becomes a cancer cell and then grows. After growing, it starts invading, and then it gets into the blood circulation. So that is the location of where the cancer arises. So there are multiple stages, the breast cancer location and stages of growth. All of them are dependent on how large the tumor is and how much it has spread. T0 is where the cancer is completely confined inside that tube or the duct. Whereas stage 1, 2, 3 is how much farther has it gone, how large has it got, and finally stage 4, T4, where it has spread to the brain, to the lungs, to the liver, and to the bone. But I say, know your body. You are the best person to be able to detect breast cancer early. Early diagnosis is the best treatment for breast cancer. Look for changes in color. Do your self-examination every month. Look for bloody discharge, breast or nipple pain, pitting of the skin. That means like a pulling in, dimpling of the skin, a lump in the breast or pulled in nipple. Under all of these conditions, go to your primary care and say, please look at this. They will recommend a biopsy, etc., to find out whether it's a cancer or whether it's a benign, harmless growth in your breast. What are the technologies to detect breast cancer? And these have gotten better and better. There's the mammogram, the women's bane. It's very, very painful, but get it done. Hate it, but get it done. There's 3D digital mammography, also called breast tomosynthesis. There's breast ultrasound, and there's MRI, or magnetic resonance imaging, and molecular breast imaging, or MBI. Why is MBI important? More and more young women are getting breast cancer, and we can't detect it with the mammography. Their breasts are too dense or too fibrous. But this machine, the MBI technique, is able to detect cancers even in these dense young women's breasts. What are the stages of breast cancer? Stage 1 to 4, Again, similar to prostate cancer, when it is localized, it's called stage 1. As it spreads out and starts invading the other organs, it's called stage 4. And how is treatment for breast cancer determined? There are markers, or these are proteins that are produced by the cancer cells. They look for these proteins and say, you are ER positive. What does that mean? That means that your tissue, your tumor tissue, is expressing estrogen receptor. And why is that important? Or they will say PR positive, or there's a large quantity of HER2 protein. Why are these facts important? Because depending on which of these markers is high, treatment for these specific markers is available today. It was not 50 years ago. It is now available for each specific type of breast cancer. So the treatment possibilities are tamoxifen, which blocks the estrogen receptor, and the tumor cells die. Aromatase inhibitors does the same thing. It blocks the production of estrogen, and the tumors die because they don't have the food they need to be able to divide. Herceptin and pertuzumab are for the HER2 marker I spoke about. It used to be a death knell. Once you knew you had HER2 positive cancer, you would die in 5 years. But no more. Now, there are at least 3 drugs that attack this particular marker. And because they attack the marker, the tumor cells just die. So this is a beautiful advancement. New ones are PI3 kinase inhibitors and chemo and immunotherapy. Immunotherapy is not very effective for breast cancer, except in a small fraction of tumors that are called triple negative. Even there, the successes have been pretty meager. How do you prevent breast cancer? What can you do? Have your kids before the age of 30. This is pretty important for a good step to prevent breast cancer. Breastfeed the babies for a year. That is what the breast was meant for, so use it for that. And as long as you feed the babies, tumor cells don't have a very good chance of dividing or being formed. Hormone medication to stay young can trigger cancer cells to grow. So I strictly avoid any mention of this hormone medication to have, I have hot flashes, so let me have some hormone medication. Wrong. Just go through it, tide through it using some plant substitutes, but don't go for hormone medication. Go for your yearly mammogram. Hate it, but get it done. Now, a cancer cell takes decades to develop. 40 to 60 years is quite common. So, if it takes decades to develop, can you halt cancer? And the answer is a resounding yes. Yes, you can prevent a large number of cancers just with the way you live, your lifestyle, what you eat, and what you expose your body to. So a prevention recipe is healthy weight, physically active, a healthy diet, avoid stress, avoid alcohol, and do not smoke. The World Cancer Research Fund estimates that at least 18% of the cancers diagnosed in the US are related to body fatness, physical inactivity, alcohol consumption, smoking, and poor nutrition. Exercise moves waste products faster. Exercise promotes good use of the insulin. Exercise boosts the immune system. It triples the level of killer T cells, raises the level of high-density lipoproteins, and in all keeps you healthy. And I say, if you have no time for exercise now, you had better reserve a lot of time for disease later. And 30 minutes daily is the recommended minimum for exercise. So we know that stress promotes poor health. A large number of bad hormones are released into the body, giving you a sense of ill-being. And the solution, I feel, is meditation. Meditation is a time-tested method for relieving stress and leading to a better and a calmer understanding of others. And test test it out using very simple methods in our meditation tent. Meditation relieves stress and leads to calmer understanding of others. This is an important message to understand. Can your diet really reduce cancer? On the left, I show you donuts and French fries and so on. Very tasty, but terrible for your body. On the right is the diet that I would like you to follow. And what are these? Raw fruits and vegetables, especially cruciferous vegetables, contain sulforaphane. They provide antioxidants such as vitamin C and beta carotene, and all have anti-cancer properties. But which ones are the ones that are really rich? Indeed, the cruciferous vegetables, broccoli, cabbage, Brussels sprouts, mustard greens, kale, they contain sulforaphane. And sulforaphane is a chemical that boosts your immunity and stops the cancer cells from progressing to the next step. Soy has great anti-cancer properties. 17 out of 26 animal studies reveal that soy or soybean isoflavones reduce tumor development. And 19 out of 21 human studies provide evidence of protection against cancer, especially breast, rectal, and stomach cancers. I also mention a warning note for those who already have breast cancer. Those would be the people who would avoid the use of soy because soy contains estrogen, a plant estrogen, and that plant estrogen could make your cancer cells grow faster. Soy milk intake reduces prostate cancer risk. What could be easier than drinking soy milk? So you could have it through soy flakes, you could have it through soy flour, you could have it through soy milk. And what this shows is that the relative risk of prostate cancer became really, really low when even more than one serving, daily serving of soy milk was taken by men. So 2 or more cups of soy milk reduces the risk by 70%. And this contains 4 to 10 milligrams of the active ingredient called genistein. The verdict is in. I've always loved garlic, but indeed, garlic is very good for you. Garlic may protect against cancer. Why? Because it contains a large amount of antioxidants. Importantly, it also helps to remove free radicals, which are dangerous molecules, from your body. So 50% reduced risk of developing cancer with high consumption of garlic. And colorectal cancer risk was reduced by 50% in a human study. And this study was not small. It had 41,837 women, and they examined 127 food items, and the strongest association with prevention or cancer-free life was with consumption of garlic. Turmeric, and this has been a mantra all through my life, turmeric is great for you. Turmeric contains a compound called curcumin, and this protects against all types of cancers. It's hard to take because it's poorly available to cells. So I recommend do not spend money on turmeric pills or taking the powder in a dry form because the body is not able to absorb the goodness of turmeric if it is in a pill form. Turmeric has to be put into hot oil to release its goodness. Put a little sprinkling of pepper there, and the piperine in the pepper helps the goodness of turmeric to be absorbed by your body. So a shot of pepper in all of your foods where you add turmeric. So hot oil is critical for turmeric's bioavailability. So what should your shopping cart look like? Lots of fruits and vegetables. Look for the plant-based proteins, dairy and dairy alternatives, whole grains, brown rice, whole grain pasta, oatmeal, quinoa. Cooking oils, use olive oil and low-fat oils like like canola. And among beverages, green or herbal teas, water, coffee is okay. What are the recommendations then? Be as lean as possible without becoming underweight. Be physically active for at least 30 minutes each day. A bad diet is responsible for 30% of the cancers and nearly 80% of heart disease and so on. So, bad diet can be corrected. It is in our hands to correct that. Eat more of a variety of vegetables, fruits, whole grains, and legumes and beans, and reduce stress through meditation. The importance of daily meditation cannot be underscored. When we meditate, we come in contact with a wellspring of joy and contentment. Meditation provides relief from worrying about the past and worrying about the future. Once we realize the light of God within us, we will see the light in all the other human beings. A time out for you to collect yourself and connect with the divine residing within each of us. And meditation inculcates a feeling of oneness with fellow human beings. When you meditate, I say, you build a shield around you each day, and that shield protects you from all negative things that come your way, negative thoughts, negative words, negative anything. And so, indeed, meditation is the key to a happy life. And cancer prevention tips, your diet can help you live longer by protecting you against heart disease and cancer. And that will nurture your outer self. Meditation can bring peace into your life, and that is nurturing your inner self. And so you will not only live longer, but enjoy peace and lasting happiness. Thank you very much.
Thank you, Dr. Sukumar, for your wisdom, for sharing your knowledge, practical guidance, and cancer research. Let's all give her a huge hand for today's talk. Thank you. And thank you all for attending and being so engaged in this conversation. Veggie Fest would also like to thank all our sponsors, whether these are corporate or nonprofit entities that made it possible for us to be here today and have this conversation together. Thank you all for coming.